Hello and welcome. At Florida Blue, we know choosing how to receive your Medicare benefits is an important decision, but it doesn't have to be complicated. In fact, let us simplify it and offer you Find Your Advantage, brought to you by Florida Blue. For round one, we're going to tell you a little bit about Florida Blue. We have been providing healthcare coverage for Floridians of all ages for more than 75 years and serving Medicare beneficiaries just like you for more than 26. Our dedicated agents and Florida Blue centers are proud to give you the personal attention you deserve. Florida Blue. Choosing blue means so much more. So, with no further ado, find your advantage. Our categories today are: what are my Medicare options? Medicare guidelines and facts. Enroll it around. What to expect when I enroll. Review, and look back at what we've talked about today. And finally, what's next? Where to go from here? So, let's get started. You can only enroll in, drop, or change your Medicare coverage during certain times of the year. These include the initial election period, or IEP, the annual election period, or AEP, the open enrollment period, or OEP, and last but not least, special election period, or SEP. The initial election period is when you are turning 65. You have 3 months prior to your birthday month, the month of your birthday, and up to 3 months after your birthday month to enroll in Original Medicare, a Medicare Supplement, Medicare Prescription Drug Plan, or a Medicare Advantage plan. The AEP is when you can join, switch, or drop a Medicare plan. It runs October 15th through December 7th every year. OEP runs January 1st through March 31st. During this period, if you are enrolled in a Medicare Advantage MA plan, you are allowed to make a one-time election to go to another MA plan or Original Medicare. If you enroll in Original Medicare, you may also purchase a Medicare Supplement and/or prescription drug plan. If you miss any of these enrollment periods, you may still have an option to enroll during a special election period. These are certain situations or events that happen in your life where you may be able to make changes to your Medicare coverage. Ask your friendly agent after the presentation to see if you qualify. When it comes to Medicare, you have a couple of different options to choose from. There are 4 parts of Medicare: Parts A, B, C, and D. Original Medicare, Part A and Part B, Medicare Advantage plans called Part C, and prescription drug plans called Part D. There are also Medicare Supplement insurance policies. More on them later. Original Medicare is made up of Medicare Part A and Medicare Part B and does not include prescription drug coverage. Medicare Part A covers you when you're in the hospital or if you need skilled nursing or home health services. Part B covers your doctor and outpatient visits. In order to get Part B, you have to enroll and most likely will have to pay a premium. If you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty. It's important to understand that Original Medicare does not cover all of your medical expenses. That is why some people choose to buy a Medicare Supplement insurance policy, also called Medigap policy. Medicare Supplement works together with Original Medicare to cover costs Original Medicare doesn't pay. And if you need drug coverage, you can also add a Part D prescription drug plan. These are called PDPs. Private health insurers like us, Florida Blue, offer what's often called Medicare Part C. It combines all the benefits of Medicare Part A and Part B and may include more services than Original Medicare covers. Most MA plans include Part D prescription drug coverage as well. There are a lot of different plans with a lot of different benefits. Let's talk about 2 of the most common types of Medicare Advantage plans. The first is an HMO, short for Health Maintenance Organization. The other is a PPO, or Preferred Provider Organization. With an HMO plan, in most cases, you will not be covered unless you use in-network providers. You choose a primary care doctor from a network, or you'll be assigned one to coordinate most of your care. You have to receive a referral from your PCP to see most kinds of specialists. Out-of-pocket costs will often be lower than Original Medicare, but there is no coverage for out-of-network care unless you have an emergency, need urgent care, or kidney dialysis. With a PPO plan, you can choose healthcare providers that are in a network for the greatest savings, but you have the flexibility to use healthcare providers who aren't part of the network. You can still use your PPO when you travel outside of Florida and its networks. If you use healthcare providers that are not part of the network, you could be exposed to higher out-of-pocket expenses. The exception is emergency, urgent care, or kidney dialysis. Talk with your agent to see if an HMO or PPO is right for you. Whether you have Original Medicare or Medicare Part C plan, there are guidelines to follow. Let's take a quick detour to make them easier to understand. Medicare Advantage plans are offered by private insurance companies like Florida Blue, and they cover everything that Medicare Part A and Part B cover. Some even cover prescription drugs. The health plan will then pay your doctors and handle your plan, not Original Medicare. Keep in mind, when you enroll in a Medicare Advantage plan, you still have Medicare. You don't lose it. Medicare Advantage plans replace Original Medicare. The Medicare Advantage plan will issue you a new member ID card. You won't be using your red, white, and blue Medicare card, but keep it in a safe place. Some more guidelines. When you select an MA plan, you still have to pay your monthly premium for your Part B coverage unless your Part B premium is paid for you by Medicaid or another third party. The premium is in addition to your Medicare Advantage plan's monthly premium if that plan has one. You can only be enrolled in one type of Medicare Advantage plan at a time. If you are currently enrolled in a Medicare Supplement plan, let them know you have enrolled in an MA plan. The Centers for Medicare and Medicaid Services, CMS for short, requires all private insurance companies like us to provide the same benefits as Original Medicare. They review and approve these plans every year, and they are the government agency we, Florida Blue, are accountable to. Just like you'd rate a hotel or a restaurant experience with a star rating, the government gives private health plans an overall star rating every year based on how well they perform. So be sure to ask your agent about star ratings, including ours. Before you can enroll in a Medicare Advantage plan, you have to meet certain requirements. You must be entitled to Medicare Part A and enrolled in Medicare Part B. You have to live in the plan's service area. If you have end-stage renal disease, you are usually not eligible. However, exceptions do exist. Okay, back to the game. Part D was created to help people afford the prescription drugs they may need. There are two ways you can get Part D prescription drug coverage. You can enroll in a standalone Medicare prescription drug plan called a PDP. If you want extra protection, you can enroll in both a PDP plan and a Medicare supplement plan to help cover costs Original Medicare does not. Or you can enroll in Medicare Advantage Prescription Drug Plan, MAPD, that includes both medical and prescription drug benefits in one convenient package. An important consideration when selecting a drug plan is the list of drugs covered by the plan, called the Formulary. Ask and make sure your drugs are covered before joining any standalone PDP or Medicare Advantage prescription drug plan. Even if you see your medicines listed, in some cases the insurer may require you to try certain less expensive drugs first before they'll cover a more expensive drug. This is called step therapy. There may also be prior authorization requests or quantity limits. A few important things to know. If you choose not to enroll in Medicare Part D when you become eligible, or if there's a period of 63 or more days in a row when you don't have Part D or other creditable prescription drug coverage, you may have to pay a late enrollment penalty when you enroll in Part D. That's an amount that's added to your Part D premium every month. If you qualify for a low-income subsidy from Medicare, also known as Extra Help, there is no late enrollment penalty. Medicare provides extra help to pay prescription drug costs for people who have limited income and resources. You may automatically qualify for extra help, and if you do, Medicare will mail you a letter to let you know. There are lots of ways to see if you qualify. Here are some of the phone numbers you can call. And you can go online anytime. Ask your representative for more information. Let's change gears a bit to talk about the different stages of Part D coverage. There are 4 stages to Part D coverage. deductible stage, initial coverage stage, coverage gap, and catastrophic coverage. The first coverage stage is the deductible stage. If your plan has a deductible, you pay the full costs of your covered drugs until you reach that deductible amount. And then you move into the initial coverage stage. During the initial coverage stage, you will pay a copay or coinsurance for any covered prescription, and the plan pays the rest. If during the calendar year, total costs, what you pay plus what your plan pays, reaches $4,020, your initial coverage ends and you enter the coverage gap, often called the donut hole. It's called a coverage gap because during this time, the plan's prescription drug coverage becomes more limited than in the initial coverage stage. When you enter the coverage gap, you'll be responsible for more of your drug costs. In this stage, you pay no more than 25% of the cost of generic drugs and no more than 25% of the cost of brand name drugs. Most people who reach the coverage gap remain in it for the rest of the calendar year. However, some people have very high drug costs and move into what is known as catastrophic coverage. If this applies to you, please speak to your sales agent at the end of this presentation. So, what can you expect once you enroll? Your application will be sent to CMS for approval. You'll receive a letter to confirm that your application has been processed. Medicare will confirm your enrollment. You'll receive your Medicare Advantage Plan member ID card. Remember, this replaces your red, white, and blue Medicare card. Your member benefit package will arrive in your mailbox. You will be contacted about completing a health questionnaire and to schedule a health evaluation. After this video, your agent will review two very important documents: the Summary of Benefits, which will cover important information and many of the specific features regarding the Florida Blue Medicare plans that are available to you in your area, and the Formulary, which is a list of drugs covered by our plans. We want you to feel confident with your decision. Your agent is here to go over any questions you have. We're almost to the finish line. Along the way, we've learned some important things. Original Medicare covers most costs associated with hospital stays, visits to your doctor, and many preventive services. In addition to Original Medicare, you can purchase a Medicare Supplement plan with or without a standalone prescription drug plan to help cover some of the costs Original Medicare does not pay. If you only want drug coverage, you can purchase just a standalone prescription drug plan, or PDP. If you want to replace your Original Medicare with a single plan, you can enroll in a Medicare Advantage prescription drug plan. Medicare Advantage plans include Part A and Part B coverage, often include extra benefits that Original Medicare does not cover, and usually includes Part D prescription drug coverage. We offer it all in one Florida Blue Medicare Advantage plan. Choosing Blue means so much more. You made it, and look what you've won. Great coverage, peace of mind, and the service and support you get with Florida Blue. Congratulations, and thank you for playing Find Your Advantage.